Good evening, and thank you so much for all joining us this evening for our live webinar with Dr. Shiraz Khan. This evening he is going to take us through the world of clinical photography and how you use that with modern practice. We would like to bring it to your attention that at the end of the meeting you will receive your email with your ECPD 1 hour link. And also at the bottom of the screen we do have the Q&A section, so please load any questions as we're going through, and Dr. Shiraz Khan will kindly at the end take us through a Q&A session. Thank you very much, and over to you, Dr. Shiraz.
Thank you, Emma. Thank you, Thomas. Hope you guys are well. Hi guys, hope you're well. Thank you for tuning in on another Thursday evening to listen to me ramble on about something to do with how we record teeth. So a big thank you to everyone that's taken the time to join, but also a big thank you to Colgate because yeah, you know, they're supporting this. So I talk about demystifying clinical photography. Well, the thing is we're in a current day and age where actually photography is going to make a big part of what we're going to be doing going forward, whether that's publication, whether that's social media, whether that's discussing things with your patients. And actually I probably would stick my neck out here and say that I think it's quite difficult to treat patients, for me personally now, without taking photographs. You hear about all these things, ethical selling, and how you need to tell people or what you need to say to people to uptake treatment. You know, if there's a photograph of a tooth that's broken, it needs treating, and that's all of a sudden much more valuable to the patient than what you think or might say. Incidentally, even if it doesn't hurt them, they're like, oh, but it doesn't hurt. Yeah, it might not hurt, but it's actually there. So photography is it's got a really, really big place in my clinical practice, but I think it should do in everyone's actually. So the aims and objectives is really to understand how we can use clinical photography in modern day practice, but as a practice as well, to describe what the ideal setup really is, and sort of show how you can diagnose with photography and how the patient can diagnose photography. And then I'll talk to you a little bit about social media, because we're in the day and age of social media now. A lot of people are opening Instagram accounts to showcase their clinical content, and I think that's a good thing in the scheme of things, provided you're doing it in the correct way. So I'll be talking a little bit about that. I'm sorry for those that tune into a lot of my lectures, you'll probably hear this slide again and again, but I like introducing who I am actually. So my name's Shiraz Khan, obviously graduated from the University of Birmingham in 2013. I did a foundation training year in Kent, Surrey, Sussex in 2013 to 14. And then I decided to take a sideways step from clinical practice and go into the hospital setting. I hadn't had that much experience in surgical elements, but also wanted to understand what restorative dentistry was about in the hospital setting. Finished that, and then I've been working in practice in London since. I undertook a master's in restorative dentistry, which was at the University of Birmingham. Fantastic program, really, really practical. And obviously Lewis Mackenzie, who was the clinical tutor and lead for the program, academic lead. It was really something that I needed to push myself into a more academic understanding of why we're doing what we're doing. And I felt that was important to me. For those that want to ask more questions about that, we can talk about it later. But masters aren't for everyone actually. And there are other courses that you might be able to get better techniques or knowledge about if it's something quite specific. So this is where I work. This is Wimpole Street. It's 28 Wimpole Street. I work at LCIAD with the very well-known Dr. Corey Ferran. Very, very fortunate to be working there. It's across the road from the BDA. I work at 11, which is also on Devonshire Place. So Devonshire Place is almost an extension of Wimpole Street, just further down. So I'm working at this clinic, which is, I've been working there for 2.5 years now, coming up to 3 years. And also work at Chelsea and Fulham. So I'm very, very privileged to work in the practice that I do. And I work with some fantastic teams. So just a quick shout out for those that may or may not be interested. I've designed and running a program called Sculpt. Now what that is in essence, so I'm just going to rotate because there's a bit of a flare from the light, and my team were telling me that was ruining video. It's a opportunity to practice posterior composite from home. We have devised a system where we will give you a monthly box. Basically, we'll have everything you need to do the sessions, and you tune in live when I'm doing the sessions and you follow along. So something that if you might be interested in, you might want to give me a shout about, really. But obviously I've done some publications, whether they're clinical or non-clinical, English, German, you name it, it's been there. I'm very fortunate to be on some covers of some magazines, which is a real privilege. But also I've been doing a lot of lecturing. Obviously you guys here that know that I've been lecturing for quite some time on the various topics: restorative dentistry, aesthetic, photography, full mouth stuff is starting to come about because I'm doing more and more of that. So yeah, I've got a passion for sharing. I think it makes you better as a person and a clinician, really. And I've been very fortunate to have lectured all around the country and around the world. Right, all that bit done. That's the intro of me, right? So I was trying to keep that below 5 minutes. So I'm 1 minute over, so apologies for that, guys. But what I wanted to talk to you about is why are we going to take clinical photography? Well, I've sort of mentioned it in the introduction. Why is it so important? What are the needs? Why do we have to be an engineer and an artist and a photographer and a psychologist and all these various specialisms within dentistry? Why do we have to be all of them? Well, basically, for me, photography has changed my practice and has propelled my career progression. First thing I want to say is that you always have to make sure you're getting consent for photography. Even if that's just for photography to hold in your practice, you need to ensure you're having consent. Now, very, very important point to note is that actually, if you're going to be posting on social media, it's ideal to have enhanced consent. So basically what that in essence means is that the patient is being clearly, they understand that the photographs are part of their clinical records, they might be used for publication, but a separate point about that publication is social media and marketing. So I think it's very, very important to specify that, because if you're going to be sharing work, actually I was in a Clubhouse meeting 4 weeks ago with someone who was talking about clinical photography and how the standards from the General Dental Council can be affected in all sorts. By and large, if you are taking a photo where the patient is identifiable, there has to be that enhanced level of consent. If it's an upper left 7, they probably can't be identified from it, so it's not the end of the world. But the other, the reasons for photography, patient motivation diagnosis. So here's a patient who comes in, obviously they didn't come in with a rubber dam. I obviously put that on because we were going to be doing treatment, but they had an example of ICTAS 2, ICTAS 3, and ICTAS 4. For those that do or don't know, ICTAS is the International Caries Detection, basically, and management system. So how you grade caries, okay? And this is really, really helpful for patients because you can see on the 6, for example, now it's not really, maybe there's a bit of shadowing started, but actually there was nothing visible on any X-ray. That I'm probably happy to do topical management. Okay, the 7 in this case, yeah, that's perforated. You can see the enamel underneath is slightly grey, but also it's catching the probe. Okay, and that's a really important part. So that's ICTAS 3. So that's whether you intervene or not. That's your call. But I intervened. And this is ICTAS 4. So there's a frank opening and cavity where food is getting caught into the central fissure. So again, I think for patients to be motivated, they kind of need to be able to see what's going on, but also the differences. And if they're able to understand those differences, they'll understand why we're going to be doing what we're doing. So therefore, selling isn't really part of the story. There's no selling involved. I don't sell any treatment. What I do is I communicate the problems. What the options are, and what the problems are if we don't treat those issues. So obviously, and this is the perfect example. So let's go back to the picture. The rest of the 6 in this scenario, I'm not going to restore. But what you are going to do is you're going to apply some topical fluoride. Yeah, so you can explain to the patient the reason that we're going to be applying that fluoride is because this is not as far down the line as the 7 and the 8, for example. And obviously, you very, very well know that Marino and colleagues have shown that you can get a massive reduction in DMFS. So for those that don't know, decayed, missing, filled, sealed teeth. But also, as soon as we're done, they're going to go away and they're going to have Durafat 5000 for the next 2 months probably, so that if there is any caries that has started, we're going to change the hydroxyapatite to fluorapatite, and that's a stronger and more resilient substrate that will minimize caries progression. So, for this patient in particular, that was a protocol we used, and having the photos in front of us make them understand why we're going to leave this one, why we're going to treat this one, why we're going to leave this one. But again, let's talk about patient motivation diagnosis. This patient had a CRCP. For those that don't know, that's a centric relation contact position. So they had a CRCP position on their 8, and you can quite clearly see. And those that may, if you go back to the initial photo, it's there, but it might not be visible. When you zoom in, you show the patient, look, can you see this bit of tooth that looks like glass? It looks like it's been sliced. Well, the reason for that is ultimately because you're sliding on that tooth almost every time you close, and that's an issue, and we might need to treat that. Because, so again, a discussion about occlusal assessment, whether we need to do anything about the wisdom tooth, do we need to consider extraction, etc. These conversations all open up because it is clear why we're going to be doing what we're doing. So that's that very, very clear wear faceting that started. And obviously here's the restorations that we did. So the 6 we didn't treat, but the 7, you can see it was a small hole to start with. I did a physiorectomy in the end, and that was after it was cleared. And the 8 was quite significantly carious. Okay, there was a lot of caries, and it wasn't just arrested, it was soft, it was scooping out with my excavator. And after you've restored, you try and conform to the occlusion. And again, I think this is really, really important. It's all very nice to do all these, glorious types of restorations, but frankly, we need them to fit the patient. And again, patient motivation diagnosis. Hi doc, I've just come in for a checkup. I haven't had any issues. Okay. Are you aware that you lost filling on the back of your lateral incisor? Oh no, I wasn't actually. It's not hurting or anything. Okay, I'll just quickly take a photo. I'll do the rest of my assessment. I'll take a photo and I'll show you. Here's the photo. Okay, can you see that? Oh my God, I've had no idea that was there. So again, the power, pictures, they say photos tell 1,000 words, don't they? And videos tell probably 1,000 photos. But the patient is already understanding why we probably need to do something about that. Now, is it got caries? No, it hasn't. Has it happened recently? Yeah, probably has. Do we need to do something about it? Well, maybe not. I would be more comfortable sealing that with some composite. So again, not here trying to sell any treatment, but here quite openly saying that there's an issue, we need to manage this. Another really important facet of photography is laboratory communication. So here's a patient that we were doing, we were restoring the upper left one. It had a postcranial, it fractured horizontally and vertically actually. And we need to replace the tooth. Well, what are we going to do about that? Well, we ended up doing an implant restoration. So you may or may not be able to tell, the upper left one is an implant restoration, the upper right one is composite restoration. And I fitted the restoration. The patient was over the moon actually. She was like, oh, I'm really happy. I was like, look, the underlying hue of the tooth isn't quite right. It's got this red gray as opposed to sort of like a more yellowish hue, and I'd like to improve on it. They're like, oh really? I'm quite happy. I was like, I know you're happy, but I think we can get we can get better. So again, we take this photo. If you just send it back to the lab and you're like, oh guys, we need to improve this because it's the hue's out. Well, they're going to be like, well, I can't really see it, Shiraz. I sent this photo. All right, we know exactly what's going on. They send me a new crown, and that's what it looks like. Straight away, they have been able to rectify, modify any type issues. They have been able to correct the color discrepancy. And actually, Hugo, the chap that did the lab work for me, was like, Shiraz, thank you so much for the photo. It made such a difference. I knew exactly what I needed to do to change the optical properties of the tooth. So laboratory communication is a big part. Obviously, you guys know I did this lovely article for Colgate, which is about whitening, how we can manage hypersensitivity. But again, if you're taking clinical photographs on a regular basis, you're able to publish your work, and I think that's something that's quite underrated in today, because we can publish our work on social media. People feel that maybe publications as such aren't as important. I'd argue the other way. Social media is slowly becoming a very, very crowded ecosphere. So if you're able to publish your work in some of the more traditional journals, etc., it might put you in good stead. And we talk about driving up clinical standards. This is one of the first cases that I had photographed. It wasn't the first photograph I've ever taken, but one of the first cases I photographed. The aperture's off, color's off. It's not really showing the restoration very, very well. This is a restoration that I have done probably about a year ago now, and I'm very, very confident that I could be able to take that photo again and again and again. And I think one of the things that if you take back anything from today, there's going to be a subgroup of people that are probably watching that have got their camera, they've got the setup, and it's probably tucked away as a paperweight somewhere. Have it out, have it on your desktop, on your tabletop. Take photos with it. Yes, you still have to disinfect it as anything else, but just pick it up and start taking photos. The more you take photos, the more you'll be able to optimize your technique settings, flash, etc. But I have no problem showing my previous work because it wasn't great actually. But the great thing is you're able to grow as an individual, and I think photography really allows you to sit back and reflect on that. So yeah, the relevance is medico-legal documentation, obviously, and patient motivation diagnosis. I didn't mention this, but if you've got a complication, so you're doing a really deep cavity and you're showing your hand excavating each step and it still perforates, well, actually, that wasn't because you were too heavy-handed with drawing. You were there because it was just too much tooth decay. So it's a good way to document complications, lab communication material for publication presentation, but also, and I think the most important one for me personally is driving up your own personal clinical standards. But as you all know, like I said, we're in a day and age of social media now, and dentistry is almost accessible, education is almost accessible through social media. Zoom isn't quite social media, but it's a sort of an online outlet which never existed, a year and a half ago. So everything's changed, and I think if I was standing here and saying to you, "Oh yeah, you should take photographs of your patient, not for social," that's not really true. I do take photos for my patient. I do take enhanced consent, but really, of course, you can use it for your social media because actually that's a great way to share, learn, grow, and it's a great way to get patients as well. So I'm not sitting here trying to preach about why photography is so good and why you should definitely be doing it and not don't do it just for social media. Absolutely, don't take a photo just for social media. Absolutely, but you know what? If you got some nice cases before and afters, you should share them because it's a great way to showcase your work. So the equipment, obviously, probably the most important part of this. So I want to give a bit of a foreword about this. The idea of this, I was in discussions with Emma and Colgate quite a lot. This is not here to be too technical of a webinar. Hopefully, me and Colgate are working on something quite big, which we can't actually announce yet. But there's going to be, fingers crossed, a series coming where we're going to be going over different things at different stages, and there will be elements of why you're going to do certain levels of photography, how you're going to document things, and a bit more technical elements to why you do what you do. This is really about why we're going to take photographs, what you need, and how you're going to do it. I really wanted to not make it too heavy for a Thursday evening. I wanted to just give you basically the basics, the equipment you need, and some demonstrations of shots that you're going to take on a regular basis. So let's start off. Of course, if you can take photography, you need a camera and you need a lens. You'll often buy a digital SLR. You can get mirrorless SLRs or you can get mirrored SLRs. It's your choice. I still use a mirrored because I think the Canon mirrorless camera is a much lighter actually setup, but I'm not quite sure that the focus and optimizations are quite there. I actually have ordered one because I want to start testing it. I still use a very ordinary mirrored SLR camera, but you need something called a macro lens. Now there's different macro lenses out there. You can get a 60mm, you can get 100mm, you can get 105mm. It does vary on brand a little bit, but the setup that I've got is a Canon and I use a 100mm macro lens. Now, some of you might be asking, why are you going to use a macro lens? Now, there's a Mr. Percy in the 1900s had an obsession with taking photographs of insects really up close. But obviously normal lenses weren't really doing it for him or for the insects or whatever. So what happened was he designed a lens that basically allows for a magnification or reproduction ratio. And what that basically means is it allows you to take high detail images of small objects really close up. That's basically what a macro lens is doing. So some people say, well, I don't use a macro lens. Well, actually, your photos are being sub-optimized for the oral cavity in general, because we need to take quite a lot of detail of very small items, and they have something called a magnification or reproduction ratio. Now, most people use either 100 or a 65 or a 75 or a 105. That's a focal length. So that, in essence, it's basically how far you're going to be from the patient in rough terms. For ease and lack of complication is how far you are from the patient. But Focal length depends on you. I mean, some people don't like 100 because you don't get as much light. Some people don't like 100 because it's heavier. At the end of the day, your setup's heavier. I've been using 100 since I've started, and all the photos you'll see today is with a 100mm setup. You need some lighting. You know, the pop-up flash that comes on your camera, it's not appropriate, because when we're trying to take photographs, we're trying to illuminate the whole mouth, okay? And we're trying to reduce the amount of shadows that are there. Now, if you use a pop-up flash, firstly, the lens is going to be here and your flash is going to be emanating at the top. So you're not actually illuminating the subject. That's why you need some sort of flash that's probably mounted to your lens or near the lens. So that's when a ring flash and twin flash come in. But actually, the reason that you'd use one over the other, it starts being a matter of personal preference. I tend to use twin flash most of the time now. You probably need some adjunctive sort of brackets if you're going to mount them beside your lens. There are some that mount directly onto your lens, but remember, the more of these things you have, the heavier your setup becomes. And sometimes it's quite hard when you're holding a mirror, or you're retracting and you're holding one hand and your hand's starting to shake because it's so heavy. There's something to be said, and that's why I'm going to be trying that mirrorless SLR, because actually the setup will be lighter in essence. Absolutely, you need mirrors. I mean, you need mirrors for taking occlusal shots. I mean, the two sets of mirrors that I would probably recommend is an occlusal mirror and probably buckle mirror. I don't use any other mirrors, to be fair. It comes in all various shapes, sizes, forms. Some are wider, some are narrower, some are longer, some are shorter. That really just depends on your patient, really. But as I showed you on this photo, we obviously need retractors. So one of the key things is getting soft tissues out the way and allowing the light to enter the oral cavity. If you're doing that, you're going to be taking reproducible images with good lighting on a regular basis. So again, the whole idea for today is not to really complicate the things that you need. What I've basically talked about is a camera, a body, so it's the body, a lens, mirrors and retractors, lighting, 5 elements. That's all you need to take photographs. There are nuances of why you would take certain things and why you'd need certain retractors over other ones. But again, I think if you've got those 5 elements, you'll be able to take reproducible clinical photography, and you just get out and start taking it. So this is the bit that most people always ask me about, and a quick forewarning about it is that actually these settings are different for different people, but people always ask me, Shiraz, what are your settings? So I'm happy for you to take a photo of this if you need to. My clinical photography settings, by and large, for my setup are the camera is in manual mode. I like taking photos reproducibly and at the same focal length. And by doing manual mode, it means that I have to move as opposed to me varying the barrel or the camera trying to work to focus it for me. Sorry, that's focus. Manual mode for the focus as well, because actually I want to focus on. But the camera's on manual because I want to control the settings. Those settings are the aperture, which is also known as the f-stop. And I'm varying between 22 if it's intraoral and 11 if it's extraoral. That's it. That's the only setting that changes. Nothing else changes. The ISO stays at 100 to 200 depending on the camera or the lens that I'm using. And the time I'm either using 1/125, 1/160, or 1/200. By and large, whichever settings I choose in that range, they stay that way. They absolutely stay. They don't change. The only thing that changes is the aperture, and that's it. The metering, which is the way that the light is managed from the camera to the lens from the subject. I call it center weighted. And the white balance is important as well. So we want to reflect natural light or daylight. So we use 5,400 Kelvin in the Canon cameras. It's called the daylight setting. If you're using what's called flash, for example, you might notice your photos are they're a lot more red. So yeah, go to the daylight setting. But yeah, they're my settings. I'm happy for you to use them. I had a discussion with someone who was on a photography course that I was running with the IAS Academy, incidentally. If you want more information about it, that's the more technical webinar. If you want more information about it, you can get in touch. But the discussion about flash, whether you're going to use ETTL or you manually vary the power. And again, I said I wasn't going to get heavy technical. ETTL means electronically it's measuring the amount of light needed through the lens. Okay, so that works for the majority of cases, but I get patients, colleagues asking me, oh, in fact, I had it earlier beginning of last week. Oh, sure, it's high. Sometimes mine are really, really dark, some are really, really light. Why is this happening? If you're doing, for example, whitening, if you take your pre-op, you'll take a photo and it works out the lighting it needs according to the subject. When you retake that photo, once they've whitened, the subject's brighter. So the teeth are whiter. The camera thinks it needs less flash power to illuminate the subject. So then your post-op looks darker. If any of you ever had that issue, it's because your lens is on ETTL. So what you'll have to do is manually change the flash power to get consistency, or you can modify them in Photoshop or some modification software. But by and large, I would say it's something that gets quite technical. Most of the time, I'm tending to use ETTL. Okay, so there are ways to take photographs with your phone, obviously. So people ask me this all the time. Can you use a phone to take photographs? You can. They're not great. If you've got the Smile MDP, Smile Line MDP, actually, it is fantastic at taking photographs of teeth. My forewarning would be I wouldn't use your personal device. I'd get a device just for the practice and create an iCloud sync for the practice so that it's not GDPR and all that because it's on your iCloud and all that stuff. I'd have a practice, and also personally, I just feel quite awkward taking your phone out of your pocket and just putting it into this device and taking photos. But the Smile Line MDP, I mean, it takes some pretty good photos. I mean, this is quite zoomed in. I've taken this from quite far back, but that's a pretty good photo. Yeah, sure, it can be optimized, and that's an SLR. So I think it's quite good to be able to see the difference. Of course, when you've got an SLR and you've got lighting and you've got, you know, a flash that's working, you probably do get more quality, obviously. But you can take photographs and very, very good photographs with an MDP. And the great thing is, as the technology on phones is increasing, the photo is getting better. So the Smile Line MDP stays the same, but the phone technology is increasing, which means that the photographs that you're able to take are increasing. I think that was an iPhone 7 that I took that one with. Views, again, something that people ask me all the time. So facial views. So guys, if you're taking photos, please don't take photos of any of the slides with patient or clinical information. This is just for the lecture, obviously. So facial views. So I often take a relaxed photo, smile photo, and profile photos, non-smiling and smiling. This is an ideal profile photo because what I want is the hair tucked behind the ear, but it's very, very important to be able to get the occiput back of the head so that you can understand the throat mandibular pain angle and lower face height. And these are all the views that I actually routinely take for orthodontics, so it's good for you guys to see these. I'll always do the smile photos because aesthetically, restoratively, that's really, really quite important for me. But I'll also take retracted photos, and the retracted photos are in two guises. One is, and this is actually straight from the IS Academy as well, by the way. One is in occlusion, because I want to see canine relationship. I want to see the molar relationship. I want to see the incisal relationship. But also, we're going to take them with the teeth slightly apart so that the teeth can be seen. The incisal edges anywhere can be seen. If we're going to be building up the canines, why would we be doing that? All ortho-restorative planning can happen from these photographs, and all the planning for where we want the teeth to go can happen from these photographs. Upper and lower occlusal shots, which are very, very important, but another massively important photograph, which I didn't really take on a regular basis until I started doing the IS pathway and academy, was this overjet photo. So what you get in this one is you retract the patient, get them vertical, and you get them to look to the ceiling. So you can show if there's a constricted, which the patient obviously has, if they've got a constricted envelope function, and how orthodontics can massively improve the patient's outcome. Not only for cleaning, not only for aesthetics, but actually for function in the long term. And again, patient motivation and diagnosis. They are now understanding why orthodontics, I mean, if you take their smile, if you take their front smile, so it's a different patient, obviously, but if you take their front smile, the teeth don't look very malaligned. If you start seeing from the lateral limb here, you see it. But also when you start seeing this very, very closed, constricted envelope, you can start explaining why composite bonding is going to be needed and why we're going to use canine risers at the end of treatment. It's not just to make the teeth look pretty, and it's not an add-on, it's functionally required. And again, quadrant or operative views for me, I think they're just so important. You know, documentation for me has gone up quite a lot over the last, I'd say 3-4 years probably. And I'm doing intraoperative steps, as you can see. And you know, if you've got a buckle mirror, you've got the rubber dam on, you get them to open as wide as can. I could take this shot every day, every day. Sometimes it's quite hard to get the 8s on because, you know, sometimes the patient's opening is a bit limited. It's that photos at that Instagram meme, isn't it, where open as wide as you can, and it's just, yeah, every time you ask them to open, it just goes as closed as it can. But by and large, you know, the ability to take these types of photos intraoperatively, it's not difficult. It's a literally point and click type situation. Good. So if anyone's heard of, does anyone know what this is? It's called a black box. Very, very creative. And everyone's probably sitting there, well, why should I put this on the slide? Well, for those that know black box thinking, black box thinking is a fantastic book. Well, it's a book, but it's based on the black box, which is in the aviation industry. And what that does is it's recording every single thing that is happening on the plane, every input that is made by the pilots, the team, the support team, everyone that's involved in caring for that aircraft and the passengers. And the reason it's done invariably is for customer safety. It's there to have a audit trail of everything that's happened, so that if something doesn't quite work out or something is suboptimal, we can grow from it. The individual can grow from it, but the airline industry can go from it, and also optimizing customer safety all the way through. And for me, digital SLR is the industry's black box, because we are able to record almost every step of the way what's going on. You can take photos in excursions, you can take photos in static, you can take videos of the patient gliding left to right, sliding forwards. You can do all of these things so that we've got an absolute up-to-date record of everything that's going on. And you know, I'm working at LCID with Core Foran, as you guys probably heard from in the introduction, and I probably thought I took a lot of photos up until I started working there, and I'm taking more photos than ever, because each step at which I'm doing the you know, if there's caries which is really, really deep, and I'm putting caries indicator on, I'm removing it, I'm reapplying it, I'm trying to show the progressive removal of the caries, not just leaving it there and saying, oh yeah, it should be fine. So I mean, I'm not saying that everyone has to document to that level, but I want to have that black box mentality, and not for a blame culture, not to protect myself from blame, but actually to drive my standards up, and also to have an audit trail if things didn't go quite right. So, you know, for me, a digital SLR is probably the, you know, I did a article for a magazine not so long ago, and it was the things that you can't live without in practice. Digital SLR is one of them. I mean, it's probably the main one. There are other things, obviously, but the digital SLR has massively optimized my ability to grow as an individual. It's been able to reflect when things haven't gone so well. And I think, you know, we're clinicians. It's not, the medical profession as such is not all that great at being able to point the finger at themselves and say, oh, didn't do that quite so right. It's not a blame culture. It's about driving your standards up. You identify areas of your weakness, you work about and make a plan or continuous development plan for trying to improve that. You remeasure and you audit yourself consistently. And with photography, you're able to do that on such a regular basis. So for me, you know, I can quite openly show that this was my first ever photograph. So, I mean, took the camera out, unboxed it, took the first shot I ever could. And this is the photo I took, okay? And again, I'm not scared to show, but we all get there eventually. But, you know, the retractors look like they're diseased, for example. I mean, the glove, I don't know why it's in the photo. Everything's out of focus. Everything's on the wrong aperture. There's not enough light getting to the terminal molars. It's an awful photograph by all accounts. But being able to take photographs on a regular basis, optimizing your setups, going on courses, learning, like you guys are here, trying to understand what the settings do, trying to understand what views you're going to take on a regular basis, you will up your photography game so that you'll be able to take photos like this on a regular basis. And I'm quite confident if I see a patient tomorrow and I need to take a 3:3 photo, I'll be able to take that photo almost all of the time. Almost, not quite, but almost. So my sentiments to you with regards to photography are that, you know, make sure you pick the camera up, make sure you're taking shots. If they're not quite right, change some settings, see why it's not quite right. Have those, you've got my base settings now, So have them print it, stick it on the inside of one of your cupboards in your surgery, so that if you start tinkering around with things and it goes right, you've got them written down so you know what they are. And the more you start getting creative with it, the more you'll start enjoying it. And photography is something I enjoy now, and obviously, it's something that's going to be here forever, really. Just a quick point as well. Intraoral cameras are fantastic. So SLRs are great for taking high detailed information, but intraoral camera is fantastic to pick up, take a photo of a tartar on the palatal or a hole somewhere. It's also great. So if you're doing that, do that as well. But if you're trying to enter the realm of aesthetic restorative dentistry and you're trying to showcase cases, and if you're trying to publish on social media, you probably want to have a more robust setup, I would say. So I thought I'd end the evening webinar with just talking about my personal, and this is just personal, social media advice. If you're going to take photos, try your best to keep all the current things. So again, consent obviously where possible, and if you can do it without showing the face, then that's advisable. Obviously, for those that do facial aesthetics, or you want to show before and afters with smiles, because obviously we treat more than just teeth. We treat a patient, we treat emotions. So if you want to show that emotion before and after, absolutely you can do it, but just make sure you have that enhanced level of consent. Try and get consistent photos before and after. That means lighting, that means focus, that means everything, so that it doesn't look like the before and after has been optimized because of the lighting. Try and take the scenario and the environment that you take the photo, try it to be consistent every time. And really, if you need to enhance the brightness, do it. Don't start elongating your root canal fillings with Photoshop. That's something I don't believe in at all. I wouldn't even know how to do it, frankly. But don't change the picture to make something look better than it is. Just play with the settings of the photo if you need to, and consider using templates. So you can make your feed as attractive as possible. So here's an example on the left where I didn't have great consistency. So I took a before and after. This was quite some time ago, actually, I took this, and the lighting was awful, actually. The lighting was poor. There was shadows on the left-hand side. You couldn't see the restoration, which the patient was not looking after, actually, after 3-4 years. So we needed to buff them up. So yeah, consistency. And if you look on the right-hand side by comparison, the lighting looks almost exactly the same before and after. So my point is, make sure your lighting is consistent. Obviously, when you're taking photographs, they don't need to be dull. So try and optimize them to be slightly brighter. So the left-hand side is with slightly duller images, and the right-hand side is actually they've not been optimized, but it was with brighter flash settings. So to ensure that you can see the before and after. So templates. So I do photography courses for practices. Smile Hub, who are in in the city, the name will come to me, very, very close to Spitalfields, that's it. They invited me to come down and talk their whole practice through, taking photographs, how we can optimize. And very, very quickly, I was able to create a perfect square grid for them with a stop for a before, stop for after, and their logo attached to it. If you want to do that, please use this as an idea. I'm here to try and share this with you. I'm not trying to hold on to anything for myself. If you have that consistent image, it looks quite nice on social media. And I'm in discussions with someone who's actually a presenter and has been on television quite a lot, who tracked me through social media, funnily enough. And I said, I'm interested, there's lots of people that are out there doing lots of work and I've got lots of followers. Why did you come and look for me? They were like, well, I wanted to look through your work and I've been looking through work for a long time. But also I just thought it looked all very, very pretty. The feed was very, very attractive, and it drew me to you and wanted me to meet you. So the Zoom consultation, they're coming in for various work and whatever. And I think that's the other really big power about social media, isn't it? We're able to, there's a way or route for patients to come in to see you, irrespective of following, frankly, but there's a way of patients to come in and see you, which ordinarily wouldn't happen. You'd ordinarily rely on a practice to provide the marketing to get you patients. Well, now we can fortunately take it into our own hands. Now, again, forewarning, if you are going to be promoting yourself at a certain practice, just ensure you have permission from that practice, because you know, you don't want to step on any toes. And there have been issues where a practice has been against a dentist because they've been taking the work that, it's all very, very complicated. So just make sure you have permission from everyone. And yeah, why not make your feed attractive? You know, social media is born and bred on making things look good as best as you can. Don't modify your content in the sense of outcomes. But yeah, why not make your feed look attractive? I'm very much into the way things look, and I want my feed to look a certain way. So I spent time on what I wanted that to look like, and you know, you guys can do the same. Good. Look, Emma, I've actually stayed to time for once. I'm always running over. But I hope this has been insightful for you to try and give you an introduction to demystify the basic elements of photography and why we want to do it. Photography, I think, is a mandatory practice in clinical practice. And I think, you know, there's less pressure on ethical selling. If you put the photos of the patient on the screen, they certainly will start telling you what the issues are, what they want to improve. I think we need to be able to allow for yourself, sorry for that typo there, allow yourselves to optimize yourself as an individual, but more importantly, we can share these things on social media. Social media is here to stay, and ensure that if you are sharing things on social media, that you've got the appropriate level of consent. So to finish, and I always finish with this quote, God rest his soul, Steve Jobs, the only way to do great work is to love what you do. And I love photography, I love restorative dentistry, I love teeth, and I love doing those things. So I love documenting them and I love sharing them. So I want to say a very, very big thank you to everyone that's taken the time to tune in. I know it's, what time is it? It's probably 7:45 now. For those that are fasting, Ramadan Mubarak, obviously. I hope you get to enjoy your food very, very shortly. Yeah, I'm happy to take some questions if there are any. And I just want to say again, a massive thank you for tuning in. I very much appreciate it. Very humbled.
Thank you so much, Shiraz, for that. It was really informative. And as you said, it was a nice perspective just to see how you do approach photography, but particularly, you know, in that relationship building context with your patients as well, which is what we get more and more insights around from practices. Please, everyone, populate the Q&A box. We have got one from Liliana, and she was saying, would it be possible for you to send or share a sample of what your consent would look like?
Yeah, sure. So I will, okay, Liliana, what I'll get you to do, Liliana, is if you write to Emma, if that's okay, Emma. Yeah. I will share, for those that have tuned into the webinar, obviously, I'll share a PDF, which is my photography consent form. So I'll share that for everyone. So if you can, Emma's my lady who sorts me out, guys. So if I forget, she'll give me a tinkle, give me a call, and we'll get that sorted. But yeah, I'm happy to share that. It's no trouble.
Perfect. I'm just entering my email address into the answers so that you all have it, and it should have been on your original invite as well. Samantha is asking, is there other courses that you run based around this? Because she would love to learn some more. Yeah,
absolutely. So Samantha, thank you for requesting that. I teach photography quite a lot, actually. I'm teaching clinical photography quite a lot. If you send me a message through, I guess, Instagram or whatever, I'll send you a link to a hands-on course that I'll be running in Surrey, which is probably, I think it's in the summer this year. So this applies to everyone, incidentally. If you're interested in the course, I am running a hands-on course for photography. It's really helpful because when we're talking about photography, it's quite easy to sit there and say, oh, yeah, you just hold it like this and you take a photo, and but my photos don't look quite the same. When you get the chance to take them in a hands-on course, of course, you're going to understand them more. So if you send me a direct message, I'll get the details of that sent to you. It's not all that expensive. It's a great day. It's at the IS Academy, and they've got a fantastic venue. They've got great coffee, great refreshments, great food. But we'll do photography for the day. So I'll send that to you. But thank you for asking.
Thank you very much. We have another one, which thanks you for your talk. And what extra oral settings do you use?
Right, so if I've got my, I'm glad I'm still sharing my screen so I can go to this. Settings, here they are. So here's my settings. So in extra all photography, the only thing I'm going to change is this one called the aperture. Okay, so that's the f-stop. That's the, without getting into too much detail, that's the width of the diaphragm that the camera allows light in from, and it affects the depth of field. So if you're close to a subject, if you're on f11, you'll get what's kind of like here. So you know how my face is in focus and the background goes out of focus, like your portrait mode to your iPhone, f11 will create that if you're doing a photo in the mouth. But if you're a decent distance, maybe 1.2 meters away from the patient, and you're taking an extra all shot, all of that will be in focus and it will allow more light into the camera for it to illuminate rather than just making a dull picture. So the ISO will remain the same, whether it's 100 or 200. The time will remain the same, whether it's 1/125, 1/160, or 1/200. They all remain the same. But great question. For extra all, I'll just drop the aperture so that more light can come in, and depth of field is less of an issue in that situation. Good question.
Thank you. We have another one. Do you upload in JPEG or another format?
Right, so as you can see, image quality, there's a contentious subject about whether you save everything as raw files, because a raw file in essence is the absolutely untampered, unedited, it's just the data. It's not even a picture actually. Some people imply that it's absolutely imperative to keep raw images, because if anything's been doctored or modified, you've got that data to start. The disadvantage of a raw is it's about 26, 27 megabytes per image, whereas a JPEG in high quality is about 4, 5, and very, very quickly, you know, that's a factor of what, 5 or 6 more data storage you'll need. And invariably, if you save the raw, you'll have to convert it to a JPEG to be able to access it or to view it. So you'll have double files. So we used, if we're going to do any modification and it's purely exposure or light, we use Photoshop, which actually puts a stamp onto the image as to what was done and when it was done. So frankly, if for any medico-legal reasons photographs need to be pulled up on, there will be a stamp as to each time something was modified and what was modified. So actually, it will still give you the original image and what the original image was. So there's image processing that can work that out. So I don't save raw. That might be against some people's beliefs, but I just save JPEGs in the largest format they have, and that's called L in Canon.
Perfect. Thank you. We have Kat sent through a question. I've started using softboxes on my twin flash and it's a little dark. Should I change my ETTL or should I change the F number?
Good question. I would like to respond with a question, but I don't know if I could do that. Who is that from? Oh, Kat. Hey, Kat, how you doing? Hi, Kat. I hope you're well. Right. So, Kat, basically, what could you just quickly type in the Q&A what f-stop you're using, because I might be able to answer that accordingly. Shall we move on to the next question while Kat types on that?
Yeah, that'd be great. So Kat's already replied. F28.
Right. So f28 is quite a narrow aperture. I'd probably drop your f number down to f22 and see if that makes a difference for your intraoral photos. That will probably make a big difference. So drop your f number down to f22 for intraoral photos and f11 for extraoral, and you'll find the photos are better. We follow each other on social media anyway, so send me a photo afterwards and see if it helps. See if it helps.
Perfect. She said, thank you. What is the type of twin flash that you have?
So the twin flash that I have on my Canon is something called it's 270 EX2 flashes. And what they are is they are flashes that don't mount to your camera, but you need a bracket that mounts to the base of your camera, and it holds the flashes at sort of 45 degrees so that you get this nice lighting. There is another flash system, and it's called the 240 EX2, which is a ring that mounts onto your lens, and it has 2 twin flashes either side. So they're the 2 options. Both work really, really well. The reason I have a bracket is because sometimes I like changing the position of the light in weird ways, and it just gives you a bit more freedom and flexibility. It does add to the weight of your setup though, so bear that in mind.
Thank you. Then we have one from Emily. Do you use a different app to create templates, etc., before uploading to social media?
A different app. So I don't use a phone to do it. What I'll do is I'll make all of them. So I'm using Keynote, for those that know this Keynote now. You can just use a PowerPoint. So if you go to PowerPoint, you type, you can customize the box, instead of being portrait or landscape, you can customize the canvas basically to be a perfect square, and then just create that before and after type template with your logo or the practice logo or whatever, and just keep importing them to that, and then just export them as JPEGs and put them on your social. Nowadays, I think you can import your photos via your computer anyway for Instagram, so you can just do it on your computer and then upload them as well, or schedule them if you're mega clever.
That's perfect. That is the sort of end of the questions. Is there any? We have got a few more minutes. Is there any other questions that anyone has while we have Dr. Shiraz here for us?
I just want to say a big thank you to Emma and the whole Colgate team and you guys for tuning in. I know it's a late one. I know it's a bit of a late one, and it's probably a subject that you have to go to try and understand it. But the whole idea for today was not to make it laborious, not to make it difficult, not to make it stressful, and just simplify it. I think a lot of people try and talk about photography like it's a dark art. It's not. For me, I genuinely say this, and it's a point and shoot procedure. And the more you're doing that, the more it will become that. So yeah, just get out there. If you've got a camera, guys, start using it every day, and it will change your practicing career. I can promise you that.
We have so Emily would just like to say that she's booked onto your cohort 2 for the sculpt course, and she cannot wait.
Oh,
so look out for
amazing!
Her joining.
Thank you so much.
Monica says, what shots do you take for facial aesthetic patients?
That's a good question. So personally, I don't do facial aesthetics. So, but the photos that you would be taking for facial aesthetics would probably be these sorts of shots. So it's mainly extra oral, isn't it? So you can take full smile profile shots. The other one that I would take if I was doing facial aesthetics is the one that's at 45 degrees. So instead of looking straight on, you just have a 45-degree shot. That's quite good to show certain areas. But then if you obviously want to zoom in a bit closer and show lips, for example, you'd probably do the lips, but not necessarily smiling, but the lips together at rest. So lip at rest photo. That's a good photo to have. They're the ones I'd do if I was doing facial aesthetics, but that's probably a guesstimated answer as opposed to a more scientific, factual one, because I don't do it. If you want more information on that, a good colleague of mine, Alexandra Day, who works at a practice with me, she does facial aesthetics, and I can put you in touch with her and she can tell you all of the shots she takes on a regular basis. But I'm pretty sure I follow her on social. I'm pretty sure they're the ones she takes. So.
Perfect. And then Samantha has asked, do you recommend an intraoral camera, as in, is there a specific brand that you might recommend?
I think all intraoral cameras have got to a reasonably high standard now, actually. What I'd say is just make sure that it's something that's easy and accessible. An intraoral camera, so Tiff Qureshi, who's a big mentor of mine, he uses his every single day. He still takes beautiful photographs, but if you need a quick shot, it's fantastic and very, very helpful. So I think most of the well-known brands are pretty good, actually. I wouldn't go to Alibaba for it, if that's what you're asking. So, can I have the light on?
That's perfect. So thank you so much, Dr. Shiraz, for this evening, and for everyone else for joining us. And this will be uploaded for on demand if anyone would like to rewatch, and look out for your email to claim for your ECPD. But thank you all very much.
Thanks, gang. Take care and have a great evening. Cheers, guys.